How's it going, guys? Medium difficulty question. Medium to difficult question, okay, for Immuno Step 1 slash path. So 41-year-old woman, dry cough, occasional fevers for a year. Serum calcium elevated 10.4, should be 8.4 to 10.2. Serum ALP elevated 200, should be 50 to 150. And then we have this image here, okay? So before I address the histo, diagnosis is sarcoidosis. And the easy part is saying, you got a woman, 20s to early 40s, classically. You don't have to say African American, and elevated calcium with unexplained dry cough, 6 to 12 months. That's sarcoidosis, okay? Erythema nodosum, redness of the shins, you can see. And we don't have to have an x-ray showing biohilar lymphadenopathy, obviously classic for chest x-ray. You say, what's going on with the ALP elevation here? I've mentioned this in my prior YouTube clips if you've been following my content. You can get hepatic involvement. Okay, obviously, the non-caseating granulomas in the lungs here, classic, but it's multi-organ system, and I've seen this on NBME questions. So, not my fucking opinion. Take it up with NBME because you can get bile ductule involvement. Okay, so sometimes increased ALP direct bilirubin on the NBME exam. So, the non-caseating granulomas and sarcoidosis. Well, what's the immunologic mechanism for granulomas? You've got macrophages. If they're activated via cytokines, they're called histiocytes. And those histiocytes are going to be interacting with CD4 plus T cells. And then you've got this IL-12 interferon gamma loop. Okay, a lot of garbage, but I'm just mentioning that if you've got granulomas here with the T cell interaction, you know that's type 4 hypersensitivity. Some students are going to get emotional. I've talked about erythema nodosum before. How literature will say that's mixed type 3, type 4. It's a debate we've had in our Telegram group. The point is, if the USMLE, whether it's fucking Crohn's disease, whether it's sarcoidosis, doesn't really matter. If they show you granulomas and they're asking for the hypersensitivity type and you know T cells are involved with maintaining granulomas, then you know it's a type 4 hypersensitivity. Let's just hop to the answers. Choice A, dyspnea, hypotension, child playing in a garden. Wrong fucking answer would be anaphylaxis, probably secondary to a bee sting. Okay, so you're gonna have antigen binding Fab fragments of IgE on mast cells, basophils. The IgE will come in a close proximity, juxtaposed, cross-link. Mast cells, basophils degranulate, release histamine. Wrong fucking answer. Choice B, erythema at vaccination site, 72 hours post-administration. Wrong fucking answer. First to Arthus reaction, bit recondite, obscure. So Arthus reaction, type 3 hypersensitivity, immune complexes. So if you get a reaction, let's say erythema at an injection site right away, that's not Arthus reaction. Okay, that would be a type 1 hypersensitivity. But this is classically, I'm not going to use the word delayed because that refers to type 4 hypersensitivity, but it's a bit protracted between the antigen, the receipt of the antigen, exposure to it, and the immunologic response, 3 to 5 days. Moderna arm for COVID vaccine, redness at the injection site a week later. Okay, as an example, it's Arthus reaction. Going on more tangential discussion here. Serum sickness would be polyarthritis generally. If you give a drug, let's say IM ceftriaxone, example, and then you get a polyarthritis 3 to 5 days later. Wrong fucking answer. Choice C, in duration 13 millimeters, PPD test, healthcare worker, correct answer. So I could go on a lengthy discussion about the cutoffs, 5, 10, 15 millimeters for what's positive PPD test. If you have no risk factors, it's 15, a healthcare worker. Greater than 10 is positive. Okay, so regardless, if you just know the PPD test is type 4 hypersensitivity, then you can answer this question. So PPD test, contact dermatitis. Okay, so I was tempted to write linear row of vesicles on the leg in a patient who went hiking. Okay, so they want you to know contact dermatitis, poison ivy, oak, sumac, linear rows of vesicles. Okay, it's very buzzy. Contact dermatitis from nickel on watches, rubber. Okay, so those are other high yield causes. Let's just hop through the others here. So choice D, linear immunofluorescence in male with hematuria hemoptysis. Wrong fucking answer. Refers to good pasture, which is type 2. Okay, so anti-GBM, glomerular-based membrane antibodies, which is type 4 collagen. So classically linear immunofluorescence, because basement membrane is continuous, right? So linear immunofluorescence in male 20s to 40s with hematuria hemoptysis. Wrong fucking answer. Choice E, Thrombocytopenia following treatment for deep vein thrombosis. Wrong fucking answer. No, this is HIT, heparin-induced thrombocytopenia, which I'm asking you watching this clip right now, is this a type 2 or a type 3 hypersensitivity? HIT. I'm asking you. This is a type 2 hypersensitivity. It seems sort of like it's immune complexes, but it's not. Platelets are cells. Okay, so type 2 hypersensitivity is when you have antibodies targeting your own cells, tissues, receptors, right? So HIT it's more of a challenging one. I've made prior clips on this. In this case, wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe to my channel. And I appreciate your time. That's it.